Time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Good morning, everybody.
You had a big trip last week. You were off to New Jersey, I think, learning even more about hyperbarics.
Oh, yeah, these things are fuel for the soul. They're fuel for mitochondria, we'll say, with regard to hyperbarics. But it's such a great chance to get together with a group of like-minded individuals out there that are looking for solutions. And these folks are coming. We had folks, one gentleman from India, another physician from Ireland, and it was just fantastic collaborations, seeing what everybody is trying to do across the world to get into that space where we breathe that oxygen into the body, and in particular through hyperbaric therapy. But we want to get that body back on that healing path, and that's the mechanism when we talk hyperbarics that we talk about. Interesting thing, I was with Jason Soners out there, and he's an International Board of Underwater Medicine, and he does a fantastic job. But he's been doing hyperbaric therapy for probably, at least 15 to 20 years, and he did a great job with this course, and I fell back in love with hyperbarics. Not that I fell out of love with hyperbarics. It was the first treatment that we worked with in the clinic, and especially coming out of COVID, one of my top go-tos, of course, was ivermectin, but I also found that hyperbarics worked incredibly well for the healing response needed. In particular, the mechanism of action with that is it's antiviral, and it's bolstering that mitochondria energy production. When we get this combination together, that's that magic, what we see with responses to a lot of acute stuff that we come across. But I've seen some stuff over the last 4 to 5 years in the clinic that just continue to blow my mind with regard to foundational treatments. Of course, we started with the hyperbarics, and we moved on to ozone therapy, amongst many other approaches, platelet therapy. We continue to expand, as we talk, Dave, every week about the toolkit. I love to increase options for individuals that come into the clinic to get them on the healing path. Of course, none of these treatments are healing the body. These treatments are giving the body the tools to do what it naturally wants to do itself, which is create this healing pathway. And hyperbaric therapy, anytime we talk about disease, we talk about, and aging for that matter, what do we talk about? We talk about inflammation, okay? We talk about how well is our body able to regenerate, turn on the good genes, turn off the bad genes, stimulate collagen production, which is huge for health. And third is mitochondrial function, okay? We talk on and on about how huge mitochondrial function is. It's huge for longevity, aging. It's huge to help the body overcome disease, because any chronic disease, you could do a PubMed search and say, I would say diabetes and mitochondria. So the hyperbarics are working in many different avenues. There's well over 15 different mechanisms of action from a physiologic perspective of what happens, but we're bringing oxygen into the body in a pressurized environment. And when you do this, now it's very important when you follow this foundational approach that you do it in a manner that is safe, number one. We need to respect it. We need to know how to do it appropriately. But two, it's more than just, all right, pop in the chamber. Some people call it the tube, or they say they're taking a dive because it's like going 10 feet underwater. So as we hit the frozen tundra, it's so cold out right now, and probably maybe some permanent ice houses going up on the lakes around here now. But the tents that have been up here the previous weeks, it looks like a hyperbaric tent that we have in our clinic that you see on the ice. But these things will pressurize them and will have increased atmospheric pressure and oxygen that brings an individual down to about 10 feet underwater would be the equivalent. But, again, I'm going to say, hey, if you can only come in to do a hyperbaric treatment once in a while, it's really not worth the effort. So when folks come into the clinic here, and we say, where is your body out of balance? Where's the inflammation at? What's causing the inflammation? What's causing the decrease in mitochondrial function? What's causing the the multitude of symptoms, may it be brain fog, bloating, lack of energy, pain, what are the different things in the body? We want to do that detective work to determine what is out of balance in the body. Then we want to provide options for the individual, different paths, because we are the guide again. You are, as the guest that comes in, we are here to educate and support and cheerlead and be the guide for different paths that you can take to help and get that body on the healing pathway. And so what we're doing is saying, here's option. There's so many healing options out there that help the body get all these healing options. It's not the devices themselves per se. It's not the modalities themselves per se. It's what these different approaches are doing to create a response in the body that the body then starts doing that itself. It wants to naturally heal itself, the body does. So if you give it the right conditions or right pulses or pushes, gas and brake, then that's what you start to see. Now, again, in hyperbaric oxygen, a lot of people think oxygen is all, that's what it's all about. Pressure is another huge component of it. So we'll have folks go into a hyperbaric chamber. It's usually about an 80-minute treatment. We give you a pillow blanket service. We've got the best team around. Our nurses are phenomenal, and they take great care of our guests. And we have a lot of folks that will come in that are pretty medically complex and that may have some physical mobility concerns. And we are very attentive to your care and make sure this experience that you have is fantastic. Then we create that protocol. Again, that's the part, Dave, that's critical, because whatever that condition is, I'm going to say, okay, I think this is the protocol that's going to be best for you for this condition. So let's say somebody's coming in and they've got a diagnosis of multiple sclerosis. I'm going to look at the data, the prior studies, and I'm going to look at the mechanisms of action that are supported physiologically by hyperbaric therapy. And then I'm going to go and say, this is the dive protocol. And we call it dive because it's like being 10 feet underwater, even though you're not underwater. You're in our clinic and doing great and in a recliner in this pressurized hyperbaric experience. And everybody's protocol might be a little bit different because everybody's different. Everybody responds differently to these things, but we have to get that protocol right. And that's what we here at the Okoboji Wellness Clinic team are about, is we want results, and we want to get you the protocol that's going to be best to support that healing process by breathing that oxygen through that hyperbaric pressure. Again, that is huge to inflammation. It's huge to mitochondrial function and therefore energy production and regenerative pathways. Again, believe it's well over 5,000 genes that are affected with one hyperbaric treatment. So you start the process, but hyperbarics is a cumulative effect. And it's something that we start it and we keep going with it. And then eventually we hit plateaus, and then we talk about things like air breaks. We might take a 6-week break from it, something like that, and then we may go back at it again. But again, it is best accomplished when it is protocol driven, meaning specific to that individual's medical condition. But safe to say everybody's protocol might be a little bit different. So that's why it comes down to coming in and chatting with us.
Yeah, and that's with all the tools in your tool belt at Okoboji Wellness Clinic, whether it be hyperbarics, the case with Lene after her accident. She had a concussion, a pretty good one after her car accident, only needed a couple of hyperbaric treatments, and she was good. But you might need more. Everybody's specific to their need. Same with ozone, same with platelet therapy, same with red light therapy. Everybody's body reacts different. You talk about the body healing itself. It reminds me, you get a big cut, you put a Band-Aid on it. Well, the Band-Aid didn't heal you. You just covered up your cut until your body had time to heal itself.
Great example. Exactly. And it's many times we can get into where we And the nice way of putting it is it's a process called hormesis. And hormesis, whatever the treatment is that we're using, whether it's ozone, it's platelet therapy, it's vitamin C, it's ivermectin, it's another prescription medication, dosage is key too. So it's giving your body what it needs to create do what it wants to do, which is heal the body. But the dosage is key. And if anybody looks up hormesis, it could be the same with pretty much anything you're using. Hyperbarics, if you do too much oxygen, or you don't take a break periodically from treatments, it might be a little too much. And so it's finding that sweet spot for whatever it is. Ozone's the same way, because oxygen, although it is essential to life and it accepts electrons in the electron transport chain, that's that last step. If you get too much of it, it causes oxidative stress. And then that causes inflammation in the body. So it's a little counterintuitive to say, why would we give oxygen that's creating oxidative stress to the body? It's giving you the right dose of it, because if we give a right dose of it, it literally is putting together an internal antioxidant response by giving an oxidant exposure. And so what that means is we give a little bit of a stress to the system, and then the system responds and kicks in a response that helps the body with that stress. And many times then that is a healing response.
I've got to go, but we've had so much feedback with Molly from last week on one thing she mentioned, and that was going through labs and zinc. She talked about zinc and the lack of zinc, and how post-COVID you have found that zinc, for people that have lost their taste and lost their smell and long COVID, being super low in zinc, if we can get some zinc back in the body, might aid in that recovery.
That's it. Now, this is why there's not just any one thing. It's a combination of things. Like, think of zinc makes ivermectin work more effectively. I noted that's backed by science and in my clinical experience during COVID. And she's absolutely right. Typically, there's so many cofactors in the body, minerals, vitamins, that become deficient over time. Zinc is one of them. It's an important cofactor. It's an important cofactor for digestive processes, and it's an important cofactor for antiviral response. So that's the hard part. It's like thinking hyperbaric is the one size, the panacea that fixes everything. It's a piece of the puzzle, but it hits on many different mechanisms of action that create a healing response, the body's own healing response within the system. But if you're ignoring other pieces of the puzzle, and this is why Molly's so critical and Mychal's so critical as part of our team, and the team in general, is because we can't just get tunnel vision on one area. We have to look at the body as a whole. And so if we're making some missteps in lifestyle, diet, nutrition, and yet we're still doing hyperbaric therapy, for instance, I always say the hyperbaric is like the great fire department, puts out fires, inflammation. But if you still have some deficiencies in the body, we need to support those deficiencies, whether it's a zinc deficiency, it's an oxygen deficiency, whatever it may be, or we got to stop what we're doing lifestyle-wise that's causing inflammation, triggering inflammation. That's like lighting a wildfire. So the more of those wildfires you got going on, the more work things like a hyperbaric therapy has to do to put that inflammation out. But yeah, Molly's absolutely right. Great point, Dave. And this is why it's a process to get there. It's a commitment, folks. When they come into our space here, it's a healing. We call it a healing journey, and it's a journey for a reason. But a lot of times it's exciting because within a few months, a lot of times doing a couple of these different tweaks with our lifestyle, treatments like a hyperbaric, folks start to feel hope again. Yep. They actually start to feel better, and then they're like, "Oh, I feel better. Now I want to do more. I'm more motivated." So,
yeah, like you say, you're trying to get people to thrive during the day, not just survive. That's a big deal. There's a lot of people out there just trying to make it through the day. You want them to thrive through the day. All right, now how is the best way to get a hold of you?
give us a call at 712-339-6024. Mychal Sheridan, who does reflexive brain work, is supporting through a bunch of different treatments. He's been on the clinic or on the radio before, and will be on again. He and Molly, who does so many good things with functional journey, functional nutrition detox, functional medicine, functional nutrition. Yeah, give all three of us, we do discovery calls. And that's at that number, 712-339-6024. And you can learn more with a 15-minute complimentary visit. And then we can get you started and booked to start the journey. Otherwise, if you're like, no, I'm ready right now, I'm all in, I want to feel better, I want to start this path, then you can call and make an appointment, which that's an hour visit with us. And again, we're just off Highway 71, 3305 Berquist Avenue in Spirit Lake. So looking forward to working with everybody, seeing some new faces. We always love seeing the faces that continue to come back for. And I talk about base camps? So we start off maybe at the low base camp, not feeling so well, and then we get to that next base camp going up the mountain, feeling a little bit better, and then we keep climbing up those base camps, and that's the goal. And sometimes it takes a few years to get up to the base camps, but it's the journey, and it's the family that comes in. It's a family feel, and we're just excited to get to meet you and to get you thriving.
Very good. Dr. Meyer, always a pleasure. Have a great day. Stay safe today, and we'll chat again soon.
All right. Thanks, everyone. Be well.
Thank you, Dr. Meyer. Dr. Bradley Meyer at the Okoboji Wellness Clinic. Thrive the day, not just survive. And you can find out more at okobojiwellnessclinic.com as well. That's another edition of Wellness Wednesday.